Hello everyone, this video is day 8 of our 15 days timetable. The important points under day 8 will be discussed here. Day 8 is a Sunday, so we have 12 hours timetable for Sunday. The topics for the day 8 includes inflammation, immunity and hypersensitivity, healing. These two topics are from general pathology. Then bone, TMJ and maxillary sinus from oral anatomy and oral surgery point of view. Cementum, enamel and dentin, pulp and periodontal ligament. These three topics are from oral histology, and then embryology and tongue from general anatomy, and lastly 4 topics from ortho, which includes cephalometrics, occlusion and classification of malocclusion, preventive and interceptive orthodontics, and lastly myofunctional and orthopedic appliances. So first off, inflammation, immunity and hypersensitivity. So under that you should go through what is a transudate, exudate, the difference between them, what is a cellulitis, and what are the hypersensitivity reactions and how does it present, what are vasoactive amines, the cardinal signs of inflammation, the changes that happen in acute inflammation, what is an interleukin, what are the types of immunoglobulins, what is a granulomatous inflammation, the thing which happens in the chronic infections, then virtuous triad, what consists of the virtuous triad, what are endogenous pigments, and lastly the Ghon complex and rank complex in tuberculosis. Next topic is healing. So under healing you should know the different stages of cell cycle and what happens in different stages of cell cycle, where the cell division happens and where there is no cell division happening, and factors inhibiting wound contraction, what is a dry socket, what is healing by primary intention and what is healing by secondary intention, the factors that influence the healing, minerals required for wound healing. Next topic is bone, TMJ and maxillary sinus. So under that you should know the ligaments of TMJ, what is TMJ ankylosis, how do you manage the ankylosis, the surgical management, what is Caban protocol, distraction osteogenesis, gap arthroplasty, TMJ dislocation and the management of TMJ dislocation, the different types of incision used for condyle surgery, especially the Alcath-Bramley incision. You should know the image of it so that in case of an image based MCQ, if they put the image of type of incision, you should know what incision it is. And lastly, under maxillary sinus, you should know the drainage of maxillary sinus and the anatomic relation of the maxillary sinus, the anterior, posterior, apex and the base, where it is located, that you should know. Next topic is cementum. So under cementum, you should know the types of cementum and the location of the different type of cementum. What are Sharpie's fibers? What is a cemento-dentinal junction? What is a cementoma and what is hypercementosis, and in which condition a generalized hypercementosis happens? Next topic is enamel and dentin. So under that you should know what is a pericymeta, Hunter-Schieger bands, lines of Retzius, enamel rods, spindles and cuticles, the difference between them, amelogenesis and dentinogenesis steps involved in them, and the imperfecta included in it, that is amelogenesis imperfecta and dentinogenesis imperfecta. Just the classical clinical features and the radiographical feature is enough, no need to study in depth about it. And what are amelogenins and what are non-amelogenins, the protein name which comes under amelogenin and non-amelogenin, what is a lamina limitans, what is lamina propria, lucida and densa, the difference between a peritubular dentin, intratubular dentin, predentin and mantle dentin, what is Stone's process and what are Stone's fibers and what is Stone's layer, the lines of Von Ebner, primary, secondary and tertiary dentin, difference between them, and lastly the dentin hypersensitivity, the theory behind dentin hypersensitivity. Next topic is pulp and periodontal ligament. So under that you should know the development of pulp and periodontal ligament, functions of pulp, zones of pulp, and in which zone the plexus of Rashko are present, what is a transeptal fiber, the fibers of periodontal ligament, fibroblasts of PDL and gingiva, what is the difference between both. Next is the general embryology. So under that you should know the pharyngeal arch and pharyngeal pouch and the derivatives of them, the formation of palate, lip and face, and what are the different synchondroses and what stages of age the synchondrosis happens. Next topic is tongue. So under tongue you should know the formation of tongue, the nerve supply, blood supply of tongue, lymphatic drainage of tongue, and the different muscles and the corresponding nerve supply of it, both sensory, motor and the special sensation. Cephalometrics. So under cephalometrics you should be aware of all the cephalometric landmarks, of which the Pogonion, Gonion, Menton, Nathion, Frankfurt's horizontal plane, ascent plane, and the different analysis. So what all values you take for different analysis. So you have down, Steiner and Tweed. So under all these three, what is a mandibular plane is very important. You should know what is a broadband registration point, cervical maturity indicator, what you see in cervical vertebra to assess the cervical maturity, and what is a specialty under hand wrist radiograph, what exactly do you check under hand wrist radiograph, and what is a width appraisal. Next topic is occlusion and classification of malocclusion. So under that you should know what is an Ackermann-Prophet classification, what is Simon classification, Andrews 6 keys of occlusion, and what is the 7th key, Angle's classification of malocclusion, and Debye modification of class 1 and class 3, and what is a curve of Spee, Wilson and Monson. Next topic is preventive and interceptive orthodontics. So under that you should know the list of self-correcting malocclusion, the entire table. You should know what all comes under self-correcting malocclusion, what is a space maintainer and what is a space retainer. You should know the images because it is very important from image based MCQ point of view. What are the types of serial extraction and how it takes place, types of anchorage and fixed space maintainers. Lastly, myofunctional and orthopedic appliances. Under that you should know what is a twin block, what are the types of Frankel appliances, what is Begg's appliance and what is edgewise appliance, the order of bends in fixed appliances that includes the first order bend, second order bend, third order bend. So in what plane you give the first order bend, what plane you give second order and what plane you give third order bend is very, very important. Thank you.